This is Crystal Fenn with MedPage Today. Although the average older adult takes multiple medications, the potential for adverse interactions with this kind of polypharmacy remains largely unknown.
All my medication.
At age 95, Dr. Morris Collen, who's been a leader in research at Kaiser Permanente over much of its history, is now leading the charge to determine rates of these adverse events in collaboration with IBM.
The problem with adverse drug events is that Food and Drug does a great job for whatever they can, and they depend, their database, which is huge, depends upon voluntary reporting by healthcare professionals. And that's good. They get a record of adverse events of known drugs, like Merck with Vioxx, that's now famous, and others. But two things are the problem with that. One is they don't know the rate. They know they get so many hundreds of adverse events, but is this in what population? They don't have the denominator. Kaiser Permanente has the denominator for 8.5 million people from birth to death. It's a tremendous diverse population, probably the greatest source for rates of adverse events in the country.
Dr. Collen was a pioneer in developing computer applications in medicine, such as electronic medical records, and the research database used by his team at Kaiser to do some of the first post-marketing surveillance studies.
It became obvious that with the pharmacy data and physician diagnoses entering in the computer, we could monitor for drug-drug reactions. Food and Drug at that time was very interested, and they actually asked us, Dr. Joe Sadisk, who was then the director of FDA, came to us, and we negotiated a contract with them to monitor known adverse drug events in the San Francisco hospital and search for previously unknown events. And we were beginning to send reports to Food and Drug until Nixon's price, until the recession decreased NIH and FDA's budgets, and they had to terminate the contract. Well, so that's how the interest became in the electronic patient record and in our monitoring for Food and Drug for adverse drug events.
The new collaboration with IBM will allow Dr. Collen's team to revisit this issue with a much larger population and better data mining techniques, he said.
Finally, we have the resources, the technology, and the knowledge to do that. And so when we discovered that we were going to now have eventually 8.5 to 9 million people, that's when we decided, meaning Division of Research, to reinstate a research database. Now this is very exciting because we'll be able to, sometime in 2009, working with IBM, to monitor, use their algorithms for data mining the data for 3.5 million Northern California members, with not only for known adverse events, but for previously unknown. Now the importance of that, especially my interest now that I've reached the ripe old age of 95, and all the elderlies in their 90s are taking 8 or 10, up to 24 have been reported, different drugs. Now I asked myself in a very simple way, if I took my 8 pills in the morning and threw them into a hot cup of coffee, what would happen to them? Well, nobody has any idea. Here I take them and throw them into my stomach where there's dilute hydrochloric acid. Merck, Pardavis, everybody studies their own drugs, but not multiple drugs. So with the increasing number of elderly, and our health plan takes care of them, and the physicians prescribe drugs, medications, prescriptions for them all. The most important contribution, my highest priority for our research health database, is to help monitor for drug-drug interactions in the elderly and use the algorithms from IBM to discover previously unknown, new knowledge. That's so exciting to me, to live long enough to be able to do that. And by next year, we will be able to do that with their research database that Dr. Turtman has developed, in that we will be able to do that already. And if we can demonstrate these new algorithms and old algorithm work, we will then go back to Food and Drug, and I live long enough to establish a new contract with them that hopefully will be able to provide information to them on 8 to 9 million people on previously unknown drug reactions, especially elderly, from all the different drug houses. Now, that's my dream.
Dr. Collen said the project may begin to yield results next year, but it may be many years before the full benefits are seen. I'm Crystal Fend, MedPage Today.